One of the most common things patients tell me is this: Doctor, I was told I have arthritis, but the pain only happens when I walk, and it goes away when I stop. That is not how arthritis works. That is blood flow. Arthritis causes inflammation inside joints. Claudication happens when muscle don't receive enough oxygen. Those are two completely different biological problems, yet they are consistently confused. So, what is claudication? Claudication means exertional muscle ischemia. At rest, oxygen demand is low. Narrowed arteries keep up. With walking, demand increases. Supply cannot rise, so pain appears. And this is the key diagnostic clue. If the pain starts after the same walking distance and disappears within minutes of rest, that is not joint disease, that is oxygen math. Arthritis does not follow distance. Blood flow does. So why it gets misdiagnosed? Because X-rays show arthritis in almost everyone over 50. Imaging proves the presence, not cause. Very important. Arteries aren't visible on joint study. Finding arthritis does not mean arthritis is the problem. And why the calf is usually first to hurt? The calf muscles have the highest oxygen demand. They are farthest from the heart. They depend heavily on the femoral artery. That's why isolated calf pain with walking is arterial until proven otherwise. So location of the problem matters, and this is how. Buttock and hip pain usually is a problem from the aortic iliac disease, higher. The thigh is common femoral problem. The calf is femoral and popliteal problem. The foot is tibial disease. Arthritis does not follow arteries maps. This is how patient describes it. Not sharp pain. They say cramping, tightness, heaviness, fatigue, squeezing. That language hides ischemia. So why the exam often looks normal? At rest, pulse is present. Skin is warm. Color, normal. Why? Because demand is low. Ischemia appears only with exertion. That's why resting exam lie. How about the ABI? It's helpful, but it's not perfect. It may be normal at rest, abnormal only after exercise, falsely elevated in diabetic. Abnormal ABI does not rule out claudication. And this is the great test that you can do, the walking test. So we have the patient walk until the pain appears, and at that time, examine immediately. That's when vascular disease reveals itself. And I want you not to fall in the injection trap. Steroid injections may briefly help inflammation, but they don't fix ischemia. Temporary relief delay the correct diagnosis. Meanwhile, arteries keep narrowing. Remember this. This is not just a leg issue. Peripheral artery disease is systemic atherosclerotic disease. Claudication patients have much higher heart attack risk, higher stroke risk, reduced life expectancy. The leg pain is a warning. So when claudication becomes dangerous for the leg, pain at rest, night pain relieved by dangling leg, the gravity helps. Shrinking walking distance, wounds that won't heal, that's a critical limb ischemia. I wanted to leave you with this, my final message. If walking distance determines your pain, blood flow is the problem, not your joints. Arthritis is random. Claudication is predictable, and predictable pain always has a physiological explanation. This is Dr. Ben Mamer. Hit follow to help me build momentum to fix healthcare in America.